We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It still appears to be rare that an asymptomatic individual actually transmits onward.
We've been joined by analyst Javed Rana Saab, who's a regular for our shows. Javed Saab, thank you very much to have joined us for our show. Javed Saab, now COVID-19 is a pandemic that has engulfed so many countries, almost all the countries of the world. But we see cases increasing, multiplying in countries such as India, in our neighborhood, or in the United States, or in Brazil, or in other countries of the world. Whereas in Pakistan, the number of cases did increase in the beginning, but then started to decrease. Do you attribute the government's measures as far as the decrease in the cases is concerned?
Well, it was driven more by the natural factors, the humidity factor, the weather conditions, and less by the government measures. Because by and large, the kind of the policy that the government came up with, one can really appreciate that. But I think similar policy were also adopted by many Western countries, by many other Asian countries, but the results were not so encouraging. In case of Pakistan, the results are quite encouraging. We have just 23,000 positive cases of COVID-19, something which is very astonishing for the people outside Pakistan, because elsewhere in the world, the cases are going up. The government could have done better. I think, unfortunately, everywhere, it's not particularly case of Pakistan, everywhere we have been following the recommendation of WHO. And the WHO has been caught in its own web of contradiction. Just 2 months back, the WHO emergency program head, Dr. Maria Wen, she said that it is rare that the asymptomatic patients would transfer COVID-19 to the other people. And according to her, it was based on the data that the WHO had received from all over the world. So that means if a patient does not have symptoms, he is not transferring the virus to the others. This is WHO report. The point is, then why there has been lockdown? Why there has been the destruction with the economy because of the lockdown? So the WHO, the recommendations are very important. The medical science is in a speculative phase, and I think we should have considered this particular report, very important report, which suggests that those people who have the symptoms, they are already in the hospital or they have self-quarantined themselves. And other people who might have been positive, there might be hundreds of thousands of people positive, but if they are not transmitting virus to the other people, what was the point of having a lockdown? And this is happening everywhere in the world. So the point I'm trying to make is very clear. The medical science, unfortunately, is in a speculative phase. And we have accepted all those speculative medical science recommendations as if it is a scientific fact.
Let's come to smart lockdown and its implications. A lot of criticism came around when the smart lockdown was announced by the government. And of course, the Prime Minister had said that this is for the daily wagers who cannot stay at their places because they need to earn every day. They need to earn a certain livelihood. And then came also the Ehsaas program that the Prime Minister put into effect so that those who are in need also are being taken care of. Do you feel these measures also helped people regain their self-confidence, especially the daily wages?
I think Prime Minister's approach right from the day one was very positive, was more towards addressing the problems of the downtrodden. And I think there he had a success. We have seen less scale of, not large scale of lockdown as we have seen elsewhere in the world. We call it as a smart lockdown, but I would say that even the government could have averted the so-called smart lockdown. Going by all the facts or the figures which are available, we have to see a bigger picture. The bigger picture I'm trying to report is quite simple. The people who have been living together, one is a positive, the other is a negative. that means they are not transferring the virus to the others. Basically, the government has been following.
But Javed Sahab, that could also be due to the SOPs that are being followed by those persons who are positive, keeping a certain distance and wearing masks and not sneezing in front of those, because those are also primordial for transmitting or not the infection.
I think the scene is very clear. When the WHO says that they have collected data from all over the world, which suggests, quote, it is rare that the asymptomatic patients would transfer the virus, would transmit the virus to the others. It is rare, which means the asymptomatic patients are not transmitting the virus. So I think when that is a medical fact going by the WHO, why those recommendations were not followed. Now, lately we have seen that there were some reports, WHO clarified that their report is not yet conclusive. May I ask then, when they had recommended that the asymptomatic patient transmit the virus, what was their baseline data? It was based on purely what was happening in China and what was happening in Iran. On the basis of the data of the two countries, they recommended that the asymptomatic patients are transferring virus. So I think we could have done better, and even now, there's a lot of panic. The media is selling a fear. We know that the total number of the cases are hardly 23,000, 22,000, but the media is still reporting that it is close to 300,000. Why they are not reporting those patients who have recovered? Those patients who have recovered, they are no longer patients. So why
because the media needs to have a certain outlook on these patients, because we do not need to dispel fear among the people. We need to give them confidence so that they can lead their lives, but of course following the SOPs. Thank you very much, Javed Rana Sahab, to have joined us.